There's been a major shift with Israeli media reports saying that senior Israeli military officials now accept the Gaza Health Ministry's death toll of more than 70,000 Palestinians killed since the 7th of October 2023. The latest figures, as of late last week, 71,000 people killed, 171,000 people injured. Now, the Gaza Health Ministry records the names and ID numbers of fatalities, and UN agencies and major human rights groups have consistently backed these figures. But what's missing from the count is believed still to be thousands of people still buried under rubble. Estimates suggest more than 10,000 people are missing in Gaza. Joining me now on the line is Keren Shavit, who's a project coordinator for Physicians for Human Rights in Israel. Good morning, Keren. Really appreciate your time. On the significance on Israel's shift and the IDF acknowledging that, yes, 70,000 people have been killed. How big of a moment is this? Israel effectively accepting a death toll it had previously dismissed for more than 2 years. Good morning.
Good morning, Lester, and thank you so much for having me. It's lovely to speak about occupation at any time, even at this ungodly hour. So I would like to mention that, first of all, just a small remark. For as much as I could see online, Israel did admit it, and then they sort of said, yes, it's not going to be our official number quite yet. So that's a little bit, it's not a 100% solid admission, and they don't adopt it as their official number. So that's one very important
So it's a number
remark.
that is acknowledged but not officially recognized. Is that what you're saying?
From what I saw, they sort of said that they're not going not to admit it, like sort of with a quadruple negative. I think that either way, the question should be what is going to happen later. Are there going to be consequences to these comments of the Israeli army? Because, of course, I don't want to speculate, and we could expect anything to happen. But based on the history, Israel is not going to show any action following any admission, unfortunately.
Because
so that's
from the reports that I've read, there's also an acknowledgement from the Israeli Defense Force saying that there is, in terms of the distribution of what it considers combatants in the Gaza war and what it considers civilian casualties. What is the word on its designation of who is considered a combatant, who is considered a civilian? Of course, plenty of elderly women and children also killed over the last 2 years.
Right. Well, I mean, our organization, we're more focused on the healthcare sector. So that's, they do have their Ministry of Health, they do have their Ministry of the Interior, and Israel has access to all those ID numbers. So that's, of course, I'm sure it's going to take a very long time for Israel to say something official in that regard. But we'll definitely hear something because they'll have to give a comment on the matter. And just to, because you previously mentioned that this number, of course, includes people who were directly killed, doesn't include the missing persons. And I would like to add, of course, that this number doesn't include people who died as a result of Israeli policy in Gaza and as a result of the destruction of civilian infrastructure.
There has been a ceasefire since October last year, but since then nearly 500 people have been killed since the announcement of that ceasefire. How does Physicians for Human Rights, it's not your place to explain, but how do you reckon with that medically, legally, that 500 people have been killed since the start of that ceasefire in October?
Well, that's of course very obviously devastating news, Lester. And again, additionally to people who got killed despite the so-called ceasefire, we of course can't not focus on the healthcare sector that is, as I've mentioned already, devastated. And a lot of people still cannot get the treatment for even very basic diseases. And the healthcare sector is not receiving enough to be rehabilitated. So that's also a very important concern, because once people are getting injured, and again, as you have mentioned, all the injured people, they have nowhere to go. They cannot facilitate themselves.
Since the announcement of that
conversation in the morning.
Apologies, Keren, line is a bit distorted from my side. But since the announcement of that ceasefire, from a medical ethics perspective, what do the numbers now recognize? And as you said, there was a recognition. Now that's sort of partially been withdrawn. What do these numbers represent for not just Physicians for Human Rights, but for broad Israeli society?
Well, that's an interesting question, Lester. I think it's I'm being usually very cautious with the concept of a number, because there is such a, behind this over 70,000 people, we can imagine how many families are destroyed. And I'm being very careful with the numbers here. Even when we're bouncing back to the healthcare sector, it's even hard to estimate how many people died, as a result of having their civilian infrastructure destroyed. I can give you at least an example of the dialysis patients. I think there were roughly over 1,000 of people before October 7, 23, and now half of them are gone. So in all the branches of healthcare, these are very devastating death tolls. So, and then irreversible conditions. So, of course, it's a huge impact, not only on the Israeli society, on any society, on the world, that this situation is happening.
Keren Shavit, have to leave it there, but really appreciate your time. Based in Bethlehem, Israel, Physicians for Human Rights. Thanks so much for your time.